Good evening and welcome back to Channel 1 Atlanta News Now. I'm David Dutton. This is continuing coverage, breaking news on the coronavirus outbreak. The coronavirus outbreak is continuing to spread across the globe. As late this afternoon, there were more than 82,000 cases in 51 countries and regions. Cases have been reported in every continent except Antarctica. Here's the latest developments as officials attempt to control the virus. There are again more than 82,000 cases around the world, including 2,808 deaths. The vast majority of these are in mainland China, which has reported 78,000 plus cases and more than 2,700 deaths. Saudi Arabia has suspended pilgrimages in Mecca and Medina for people outside the country over coronavirus fears. For context, a wholesale temporary ban on foreign visits to the holy sites is a first in living memory. At least 650 people have tested positive for coronavirus in Italy. Across Europe, at least 11 countries now have confirmed cases of coronavirus, some of which have been traced back to Italy outbreak. U.S. stocks faced another sharp sell-off today as worries about coronavirus mounted. Both the Dow and the S&P are on track for their worst week since the fall of 2008, the midst of the financial crisis. Now let's get the very latest on this still developing story right now from a variety of sources as we go to CNN.
But it could represent the first example of community transmission. And that's something that we've been talking about for some time. This idea that you haven't traveled there, you haven't come in contact with a known infected person, and yet you still have the coronavirus, that's an indication that the virus is now here and starting to spread within communities. Again, the CDC is still going to chase this down. It's unclear if that patient represents this first evidence of community spread, but the president has been saying for some time, look, it's not inevitable that this will happen. Maybe we don't have any community spread at all, and which has been at odds with what we're hearing from the CDC, who has been saying it's not a question of if community spread will happen, it's a question of when it will happen. So that's why so much attention is going to be paid to that one patient. We'll certainly give you details as we...
For more than 30 years, the TV show The Simpsons has remained pretty much the same, but Lisa and Maggie never get older and Homer never gets smarter, apparently.
Let's see if we can get some more from some of our other sources.
Before the sun isn't for everyone.
Conducting a huge number of tests on all of these members, some 200,000 plus tests for coronavirus among these members. That could take several days, two to 4 days yet. Because of this outbreak, as you know, there's a vast number of U.S. service members here, 28,500 U.S. members of the military here, support staff, Korean nationals, and federal employees of the U.S. government, and dependents, about 8,000 dependents. So the U.S. is trying to be proactive in keeping the virus out of U.S. military bases. They've instituted a bunch of, temperature checks going in and out of the bases. They've also told soldiers not to leave the base unless it's for essential travel only. So a couple of measures being put in place there. And the big change today, and it's one that we really expected, is the postponement of those annual military drills with the South Korean forces. And the reason being, there does seem to be somewhat of a spread within the South Korean military. 25 members of the South Korean military have now tested positive for the virus. Some 10,000 are in quarantine, and so both sides agreed that it was best for all involved to really postpone those military drills. It's not seen as a crucial part of the military's readiness. This is what we've heard from military leaders on both sides, and really the more important thing right now for South Korea and for South Korea's military, frankly, is to get a handle on this virus and its spread.
Iran is another hot spot for the coronavirus, and now several government officials there are under quarantine. Tehran Bureau Chief Ali Arouzi explains how the country is managing the outbreak.
Hey, Alison. So new figures coming out of Iran today as numbers of deaths and cases for the coronavirus keep ticking up. Just this morning, the health ministry announced that 26 people have died of COVID-19, giving Iran the highest mortality rate outside of China, with 245 cases confirmed. That's 106 new cases in just 24 hours. Now, the health ministry spokesman told State TV that all Iranians should avoid unnecessary trips inside the country. Also, setting off alarm bells in Iran is the large number of government officials who've been infected, including the deputy health minister in charge of combating the virus, we'd spoken about recently, who we know has COVID-19, who went on state TV without a mask, coughing, showing symptoms, and then the next day gave a now infamous press conference, sweating profusely, constantly wiping his brow, and coughing in a room full of people while standing next to another
to implement emergency measures.
The spread of the novel coronavirus has evolved in the United States. The Centers for Disease Control and Prevention confirmed a 15th case of infection, but this time around, it doesn't know where the infection came from. This case is potentially the first instance of infection by community spread, which is when the source of an infection is unknown. All cases of infection in the U.S. so far have been associated with travel to Wuhan, China. But this patient, based in California, doesn't have relevant travel history or connection to another confirmed patient, according to a press release. The CDC hasn't ruled out the patient's potential exposure to an infected return traveler. CDC Director Robert Redfield said the immediate risk to the American public is low, but warned the coronavirus will spread in the U.S. President Trump tasked Vice President Mike Pence with leading the U.S.'s response team Wednesday. Last month, the Trump administration declared the outbreak a public health emergency. The White House wants $2.5 billion to fight the coronavirus, but Democrats have said the administration's plan is not good enough. Senate Minority Leader Chuck Schumer has put forward an $8.5 billion plan, and President Trump said he won't say no to more money.
They want to give us the money, we'll take the money, we'll just do a good job with it.
This is continuing coverage of the coronavirus live on Channel 1 Atlanta.
In the country after a person in California who was reportedly not exposed to anyone known to be infected and had not traveled to countries where the virus is circulating was infected. That person is now being treated at UC Davis Medical Center, according to a statement by the Sacramento Hospital. Health officials have been on high alert for community spread, which refers to the spread of an illness for which the source of infection is unknown. Dr. Dean Bloomberg, An infectious disease expert at UC Davis Medical Center says this new case means the virus may already be spreading.
We only have this one confirmed case of community transmission, but it suggests that we don't know where they got it from. So the person who exposed them probably exposed others. So there's probably other cases out there in the community that we don't know about.
The Centers for Disease Control and Prevention confirmed the infection on Wednesday, bringing the total number of cases in the U.S. to 60.
We're very, very ready for this.
The case was announced shortly after U.S. President Donald Trump addressed the global spread of the virus, which originated in China, and said containment measures had limited its spread in the U.S.
Because of all we've done, the risk to the American people remains very low. We're ready to adapt and we're ready to do whatever we have to as the disease spreads, if it spreads.
Trump announced that Vice President Mike Pence would be in charge of America's response to the virus, which has